Sleep. We all need it, but so many of us struggle to get enough of it. Tossing and turning, staring at the ceiling, checking the clock, scrolling through your phone at 3 a.m. Sound familiar? When counting sheep just doesn't cut it, a lot of people turn to over-the-counter OTC sleep aids. You know the ones, those little bottles promising a peaceful night's sleep, no prescription needed. But here's the big question. Is it actually safe to take these sleep aids every night? Or are we just trading one problem for another? Today, we're pulling back the curtain on OTC sleep aids to see what's really going on, what risks they might carry, and what you can do instead for better sleep. What are over-the-counter sleep aids? First, let's define what we're talking about. The most common OTC sleep aids fall into a few main categories. Antihistamines. The most widely used OTC sleep aids like diphenhydramine, Benadryl, and doxylamine. These drugs were originally designed to treat allergies but have a sedating side effect that makes you drowsy. Melatonin supplements, a hormone naturally produced by your body to regulate the sleep-wake cycle. You can buy it as a supplement, usually marketed as a natural sleep aid. Herbal remedies, things like valerian root, chamomile, and lavender. These come from traditional medicine practices and are often considered gentler alternatives. Antihistamines, the sleep aid imposters. Diphenhydramine and doxylamine are the heavy hitters when it comes to OTC sleep aids. They work by blocking histamine receptors in your brain, which causes drowsiness. Sounds like a win, right? Who wouldn't want to feel sleepy quickly? But here's the catch. These drugs were not designed to help you sleep. They're allergy medicines that have sedating side effects. Using them regularly to fall asleep is a bit like using a hammer to fix a watch. Sure, it might do the trick short term, but it's not exactly precise or safe in the long run. What happens when you take antihistamines every night? For starters, your body can build a tolerance quickly. That means after a few weeks, the same dose won't knock you out like it used to, and you might feel tempted to take more. Increasing the dose without guidance can lead to serious side effects. Long-term use also brings risks, especially for older adults. Antihistamines can cause dry mouth, dizziness, confusion, constipation, blurred vision, and even an increased risk of falls and fractures. And here's the kicker. Studies have linked chronic use of these drugs to cognitive decline and an increased risk of dementia. Yikes. So a sleep aid might actually be putting your brain health on the line. Melatonin, the natural hormone that's not so simple. Melatonin has surged in popularity, especially among people dealing with jet lag or those who work night shifts. Since it's a hormone your brain naturally produces to signal when it's time to sleep, it feels like a safer alternative to drugs. And to be fair, melatonin can help regulate your internal clock when your sleep schedule is out of sync. It's especially helpful for resetting your circadian rhythm after travel or shift changes. But here's where things get tricky. Most melatonin supplements on the market aren't tightly regulated like prescription medications. This means the dose in the bottle might not match the label. Studies have found some products with up to 400% more melatonin than stated. That's like taking an unknown dose of a hormone and hoping for the best. Some supplements contain additives or contaminants that aren't listed. Also, taking melatonin every night can sometimes backfire. Your brain might reduce its own natural melatonin production if it senses you're getting it from an external source, potentially leading to dependency or diminished effectiveness over time. Plus, melatonin isn't exactly a sedative. It helps with timing your sleep, signaling when it's time to wind down, but it doesn't necessarily improve sleep quality or help you stay asleep. So if your main issue is waking up frequently or not feeling rested, melatonin might not be enough. Herbal sleep aids, the Wild West of supplements. There's a long tradition of using herbs like valerian root, chamomile tea, and lavender for sleep. These are often marketed as natural alternatives with fewer side effects. Some people swear by them, and generally they're considered safe with mild side effects. However, there are a few things to keep in mind. The strength and quality of herbal products can vary dramatically between brands since supplements aren't tightly regulated. Some herbs can interact with prescription medications like blood thinners, antidepressants, or blood pressure meds, sometimes dangerously. A scientific evidence for their effectiveness is mixed, and benefits are often mild. So, while herbal remedies can be a nice complement, they're not a guaranteed solution for everyone. The risks of regular OTC sleep aid. Use. Why is daily use of these OTC sleep aids a concern? Most OTC sleep aids are intended for short-term or occasional use, maybe a few nights here and there when you're going through a rough patch. Using them nightly can lead to tolerance, needing higher doses to get the same effect, which increases side effect risks. A dependence, feeling like you can't fall asleep without the medication, which can cause anxiety around bedtime and worsen insomnia. 2. Masking bigger problems. Regular use might be hiding an underlying sleep disorder like sleep apnea, restless leg syndrome, anxiety or depression that needs professional diagnosis and treatment. Side effects. Long-term use can increase risks of cognitive problems, daytime grogginess, dizziness, digestive issues, and more. A disrupted sleep architecture. OTC aids might help you fall asleep faster, but can reduce REM sleep and deep sleep stages, leaving you feeling tired and foggy the next day. Think of it like this. You might be asleep but not really resting. It's like watching a movie on mute. Sure, the story's happening, but you're missing the important parts. What are better alternatives? If you're reaching for OTC sleep aids regularly, it's time to rethink your approach. Here are safer, more effective long-term strategies. Good sleep hygiene. Stick to a consistent sleep schedule. Create a relaxing bedtime routine. Avoid screens 1 hour before bed and keep your bedroom cool, dark and quiet. Regular exercise. Not too close to bedtime, but consistent activity helps regulate your sleep. And manage stress. Meditation, journaling, deep breathing or yoga can calm your mind. Watch caffeine and alcohol. Both can wreck your sleep quality. Professional help. If you struggle with sleep long-term, see a doctor. You might need a sleep study or treatment for underlying conditions. Cognitive behavioral therapy for insomnia, CBTI. This is the gold standard treatment for chronic sleep problems, helping you retrain your brain and body to sleep naturally without meds. When are OTC sleep aids okay? That said, OTC sleep aids do have their place, but mostly for jet lag or adjusting to shift work, occasional sleepless nights due to stress or travel, and short-term use when you're in a pinch. Just remember, they're tools, not cures. Final thoughts. Sleep is critical for your overall health, from brain function to immune support to mood regulation. While OTC sleep aids can offer temporary relief, relying on them every night can cause more harm than good. If you're reaching for sleep aids regularly, take a step back and ask yourself, what's really keeping me awake? Are there lifestyle habits I can improve? Should I get checked for a sleep disorder? Would therapy or other non-drug treatments help? Your brain and body will thank you for treating sleep as the priority it deserves. If this video helped you understand the risks and realities behind OTC sleep aids, subscribe for more pharmacist-backed insights every Friday at 5 p.m. Mountain Standard Time. And hey, if you have questions about medications, health myths, or weird body stuff, drop them in the comments. I'd love to hear from you. This is Pharma-Logic, where medicine meets meaning, one smart, evidence-based video at a time.